The topic for today is how long does it take to lose weight on these GLP-1 receptor agonists? Hi, and welcome to my channel. I'm Dr. Megan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications. I actually talk to patients about their weight, and I've helped hundreds of patients lose weight. And I'm here to help you too. So if you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. So, how long does it actually take to lose weight on these GLP-1 injectable weight loss medicines? Now, of course, as you would expect, your mileage may vary, but I will say that first month, people typically lose a couple pounds. But really, that first month, I am not looking for any particular weight loss. That first month, whether you're on liraglutide, semaglutide, or tirzepatide, that first month is really to let your body get used to the medication and to see how significant the side effects are going to be. That's what I'm looking for. If you lose weight during that first month, that's great, but I'm not expecting it, and that's not really the intended effect of that first dose. It's really just to let your body get used to it. So if a month goes by and you're like, hey, I've lost like no weight at all, or I lost like 1 or 2 pounds, it is not a cause to panic whatsoever. It's pretty expected. And so if you've lost weight, great. But if you haven't, don't panic. As a side note, there are always the outlier patients who, month 1 or month 2, they lose a lot of weight. Now, that can also be because they had pretty significant side effects. They're really having issues with their appetite or having a lot of nausea. So, if you've heard about patients like that, that is number one, not typical, but also number two, those people often aren't feeling great, and it's certainly not the intended or expected effect. So by month 2, I'm usually starting to expect some consistent movement downwards, but everybody's trajectory is going to be different. Also, what is not uncommon is for people to I like to think about weight loss kind of like the stock market, where you're looking at the overall trend. So, is it going down? Yes, on the kind of bird's eye view. But if you zoom in, there might be times where things kind of plateau a little bit, and it's not always a very linear, clean, neat downward trajectory. That is not uncommon. So someone, month 2, 3, 4, they may lose weight during month 2, have a plateau month 3, and then lose weight again at month 4. That's pretty normal. There are some people who will also pretty consistently lose weight. Neither one is bad. It's just how your body is adapting to the medication. And again, not a reason to panic. But yes, by month 2, I'm starting to see, in general, some weight loss happening. Now, also, there are going to be variables. So the type of GLP-1 you are on is going to likely affect the trajectory of your weight loss as well. So if you're on liraglutide versus tirzepatide, tirzepatide is a dual agonist and is a much more powerful medication. So you might be losing weight faster or more consistently on that medication versus liraglutide. Although, of course, this is a very case-by-case situation, and I have a lot of patients who do very well on liraglutide. Also, you all know I am not on board with the compounded medications. However, if somebody was on them, you don't really know exactly what's in them, so we can't really say. It's hard to say if they're going to be effective, and so it's hard to really know because you don't know exactly what's in it. It's hard to say if you're getting the intended effect. It's hard to say what's going on if you're not getting, if over time you're not getting close to the expected effect that you would get with the FDA approved version. It's a little hard to troubleshoot because you really don't know what you're getting. So aside from the safety issues, this is yet another reason why I really am not on board with them. Also, your medical history could certainly be playing a role. So, if you have a thyroid issue, if you have diabetes, you may not get as strong an effect. Thyroid issue, if it's treated, usually it's fine, but sometimes even with well-controlled diabetes, you might not get as strong an effect as someone who does not have diabetes. Also, you might be on medications that are interfering or kind of fighting with the medication a little. So, and I've made a lot of videos about this, but there are certain medications, Paxil, gabapentin, there's so many out there. But if you are on a medication that is kind of fighting with your GLP-1 receptor agonist, your weight loss trajectory might not be as significant as somebody else's. But yes, if somebody isn't losing weight after like 3 months, usually I will try. And again, this is always, a case by case situation with the patient. If their side effects aren't horrible, or if their side effects are well managed, or they don't have any, because it is such an incredible pain to get these medications approved, to find them. I really want to give it the best shot that we can. And so usually we will titrate all the way up to the maximum dose. But if they're on the maximum dose for a couple months and they really haven't seen significant weight loss, like 5% or more of their total body weight, then it's really time to think about getting some labs. I'm always reassessing their medications, but this is a good time to do it again. And then also thinking about alternatives. So if they're taking an injectable GLP-1 like Wegovy, they may want to try something like Zepbound or Saxenda, or they may want to try an oral medication. It really depends on the patient, but usually 3 months at the maximum dose. And if there's not a significant amount of weight loss, that's a good time to really reassess alternatives. So that's going to do it for today. Thank you so much for watching. As always, if you have questions, leave them down below. If you want to work with me directly, I will leave that information down below. Like, subscribe, do all the things, and please be well.